Good morning.
Good morning.
It's an exciting day, isn't it? That doesn't sound very exciting. Let me try that again. It's an exciting day, isn't it? Awesome, awesome. Good morning and welcome. At this time, I'm going to ask that you please silence your cell phones. And if you need to step out for any reason, please do so from the rear doors. Also, we ask that you remain in your seats for the duration of the program. There will be a staff photographer capturing the students, and these photos will be made available to them. So please don't approach the stage. Now, ladies and gentlemen, please stand as you are able. Our ceremony will begin.
Thank you so very much. Ladies and gentlemen, good morning. On behalf of the Chairman of the Board of Trustees of the Philadelphia College of Osteopathic Medicine, Mr. Tom Molina, and the PCOM Board of Trustees, and President Jay Feldstein, a PCOM graduate, and an excited PCOM Georgia campus community, I bring each of you greetings this morning and best wishes from a very excited campus as we celebrate your educational journey together. From my vantage point on this podium, I see many, many smiling faces in this audience, and that is as it should be. On a quick personal note, I simply want to tell the students here that I have great professional respect for the position to which you aspire. You see, I'm currently under the care of my dermatologist PA. I went for many, many years as a kid without ever knowing anything about sunscreen, so I will see him tomorrow, in fact, on my biannual visits with him. I'm now under the care of my cardiologist's PA for monitoring my cardiac conditions after being one of those individuals who who contracted COVID in such a significant way. I'm under the careful watch of my pulmonologist's PA, again, watching my lung functions from COVID, and after years of seeing specialist after specialist, trying to figure out years worth of gastric issues, it was my primary care physician's PA who slowed down and took the time to really understand my issues and diagnose that I needed a gallbladder removal done. And so a year from that gallbladder surgery, I gave great credit to my PA in my primary care doctor's office for diagnosing the issue at hand. And then just 3 weeks ago, I was comforted greatly by my ophthalmologist PA, who gave me great peace when she explained to me that the loss of vision I had in this eye from retinal surgery, from having had such severe coughing with my COVID experience and had a torn retina, that loss of vision, it will come back, I was panicking and all nervous, and she was the one who said, calm down, it's going to be okay, you're going to be there. And so today, I am very delighted to be seeing you and all the smiling faces this morning, literally seeing your smiling faces from my vantage point this morning. Dr. Thomas, wow, it kind of makes me think I might be somewhat of a hypochondriac here today, but I do have great affinity for your profession and what you are endeavoring to do through your academic work here. Join me, will you, as we invoke a brief moment of invocation together here today. Oh God, what a great day this is in the life of our college and our PCOM Georgia campus as these exceptional students are officially presented with new white coats, symbols of authority and professionalism understood by patients as enveloping one with intellect and knowledge and a reminder of compassion and care. May these students wear these white coats with honor and integrity, demonstrating empathy and true concern for the welfare of their patients with whom they will interact and serve. May these PCOM faculty and staff continue to give of their knowledge and experiences and insights as they strive to prepare these students for the life-changing impact they will have in the days ahead. May these family members, these proud family members who have sacrificed greatly through encouragement of educational attainment, be rewarded with a great sense of pride and feelings of significant accomplishment as they continue to support these students in the days ahead. Now, Lord, please watch over all of our first responders who are there for us each and every day. Cover each member of our military at home and abroad with your blessings, and hold in the palm of your hand all members of medical teams across this expansive globe who are on the front lines and serving others. These students that we recognize today will one day be those frontline caregivers. We seek your blessings on each of them this day and forevermore. Amen. And now if you will join me in the Pledge of Allegiance to the flag of the United States of America. I pledge allegiance to the flag of the United States of America, to the republic which stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and you may be seated.
Thank you, Mr. Ginn. There is arguably no other workplace clothing as symbolic as the white coat. It has become a standard of professionalism and caring, and a visual reminder of the trust we, as physician assistants, must earn from our patients. A study was done at the University of Michigan evaluating patient response to provider attire in the white coat. In this study, more than 4,000 patients were surveyed at 10 U.S. academic medical centers. The survey included photographs of a male and female provider dressed in 7 different forms of attire. Results of the study indicated that provider clothing affects patients' impressions and satisfaction with the care they receive. Providers that wore a white coat over business attire were deemed more knowledgeable, trustworthy, caring, and approachable. Interestingly, the medical setting influenced patient response to provider attire. Wearing scrubs with or without a white coat was deemed more acceptable if in certain settings, including the emergency department, critical care unit, or a surgical unit. What we wear is an easy thing to modify. You embody the white coat. It will only require a brief encounter for the patient to see beyond the white coat and decide if you are the provider that exemplifies the traits that the white coat symbolizes. Developing and refining your character is not easy, but is essential. It requires conscious effort and commitment. It is important to understand and appreciate that the practice of medicine hinges on the patient-provider relationship. From initial introductions, PAs work to build rapport and develop a partnership that enables the provision of patient-centered care. Patient-centered care encompasses being respectful of and responsive to patient preferences, needs, and values. It encourages the active collaboration and shared decision-making between patients and providers to design and manage a customized and comprehensive care plan. I encourage you to listen carefully and ponder the words and advice shared with you today, as it is my hope that today's ceremony will help you in framing the style of medicine that you will practice. Now, I'd like to introduce Dr. Gregory McDonald, the Dean of the College of Health Sciences, who sends a video message to say a few words to the class. Please turn your attention to the screens.
Hello, welcome to PCOM's 2023 White Coat Ceremony. I want to thank all the family and friends who are joining us today for this occasion. This represents a milestone in your education, one that you should take very seriously. You're moving from a didactic experience to a more of a clinical and clerical experience. I remember my first day as a third-year medical student where I had my white coat for the very first time. I was in the hospital and I had this patient in back of me saying, "Doctor, doctor," and I didn't know who she was talking to. Then I found out she was talking to me because I had a white coat. And that told me that I had made a complete leap or change in my education at that point. And I had to make the white coat mean something to me, mean something to my school, and mean something to my patients. So best of luck and congratulations on this milestone.
I'd like to thank Dr. McDonald for the kind words. At this time, I would like to introduce our guest speaker, Mr. James Giannakakis. James Giannakakis earned a Bachelor of Science in Exercise Science from Valdosta University in 2003. He worked as an exercise physiologist for nearly 10 years before deciding to pursue a career as a physician assistant. In 2015, James graduated from Emory University with a Master of Medical Science degree in Physician Assistant Studies. Mr. Giannakakis works in emergency medicine at Emory-Hillendale and serves as the lead advanced practice provider for the group. He has led the Advanced Practice Provider Fellowship Program that trains new PA and NP providers working in the emergency department. James has been a valued educator in the PCOM PA program since 2017. His contributions include providing lectures in the radiology course, EKG interpretation, and serving as a preceptor to clinical year students. Additionally, he also serves as an emergency medicine preceptor for the Emory University PA students and was recognized as the Emory University PA Program Clinical Preceptor of the Year Award recipient in 2021. James volunteers with the Neighbor in Need East Atlanta charity. Through this charity, he evaluates and administers home repairs for low-income senior citizens. He also assists with marketing, grant proposal, and fundraising efforts for the charity. And of great importance, James most enjoys spending his time with his wife, Beth, of 20 years, and their 3 children. Please welcome Mr. James Giannakakis.
Thank you, Dr. Thomas. I too would like to give my welcome to the PCOM guests and students, of course, at this white coat ceremony. On behalf of the students and faculty, it's my privilege to welcome the family, the friends, and guests to this special day. I would like to pause before I get started and recognize everyone in this room who's made this day possible. The spouses, family members, and children who support the long hours of studying, anatomy lab. I remember those long hours. I personally was married, had a small child during my time in school, and there's a lot of sacrifices y'all make. Y'all give up your time. Y'all stay at home, keep the home fires burning, as they say, and we appreciate you for making this special day possible. So just before I get started, can we give the family members and friends who gathered here today for these students a round of applause? Thank y'all so much for being here. I know y'all are so proud. I hope Dr. Thomas will forgive me, but I wanted to start this talk in an unconventional way. She spoke about the positive connotations of the white coat. I'd like to talk about the negative connotations of the white coat. I'm a little bit of a contrarian. I wanted to talk about white coat hypertension. It's a syndrome of having elevated blood pressure, heart rate, when checking these readings in the presence of a medical professional, but having normal readings at home. Perhaps you've heard of it. What about white coat anxiety? Just anxiety around being around these white coats. You might receive negative health information or the stress of just being in the presence of somebody with maybe upsetting medical knowledge. Traditionally, these diagnoses were thought to be benign, but actually patients with these conditions have higher rates of developing hypertension, coronary artery disease. Some medical professions, most notably pediatricians, psychiatrists, they often forgo white coats to not cause anxiety in their patients. So right as you're about to get this white coat, you're like, why do we even wear white coats, right? What do they signify? I may be the worst person to speak of this, and again, apologies, Dr. Thomas, because I haven't worn mine in the ER for 7 years. To paraphrase a line from my wife's favorite movie, Steel Magnolias, white coats pick up everything but men and money. The character in the movie, Truvy, was talking about stack electricity in her clothes, picking up everything, but, I don't wear one of these in the ER because of blood, pus, all the gross things that we encounter. But the reason we wear them in the late 1800s, physicians and medical professionals wore black traditionally to convey the seriousness of their profession, similar to clergymen, priests of the time. In the late 1800s, early 1900s, you probably heard of Joseph Lister, Listerine, antiseptic medicine, and the new concepts ushered in, brought in cleanliness to the hospitals, the importance of antimicrobial practice, and physicians and medical professionals began wearing white coats to symbolize this new cleanliness and purity and integrity of the profession. Man, we've really messed up that purity and integrity of the profession, I feel like. Trust in medical professions is at all-time lows. In 1966, a study I recently read said 75% of the people said they trusted medical professionals. Today, that's less than 30%. I think that's shocking. How do we restore trust and integrity to medicine? How do we repair those relationships with patients to help patients maintain and restore health and earn back that trust? In my time as a PA, I've embraced several things that have helped me bridge these divides, and I just wanted to share 3 kind of principles with y'all today. Number 1, practice with humility. We don't know everything. In fact, we don't know a lot. We should not be know-it-alls that lord our knowledge over patients. However, we should seek out knowledge and help disseminate what we do know in easy-to-understand ways to empower our patients to make wise health decisions. I want you to go into each patient encounter with a humble learning spirit. What can this patient teach me? How can I grow in my practice of medicine by listening and learning to this patient? Number 2, each person has a unique story to tell. Sit down with them and hear it. I make it a point to sit down in each room I go in. Don't stand over the bed. You have to, we always start with the history. Sit down, sit on a trash can. If there's not a chair in the room, sit on a stool. Kneel down, be at the patient's level and listen to them. Each one of these patients is unique, has a past, a present, a future, someone who cares about them. I had a wonderful professor that said, people don't know or don't care how much you know until they know how much you care. I thought of Mr. Ginn when he just spoke about that PA that took time to listen to him about his GI illness. What a gift that was, just to have the time to speak to him and figure out what was really going on. And just what an encouragement to hear about all the PAs that impacted his health. So take the time to sit with an inpatient, especially in your clinical year. I really encourage you to listen to your patients. You have the time. Look for things that connect you to the patient versus things that separate you. It's amazing what a shared common interest can do to spark conversation and remove walls. Finally, there's been recent books that talk about what is your reason, what is your why. I feel like that's often in business books or things like that. But if it's money, of course, there'll never be enough. If it's acclaim, recognition, there's always going to be somebody better, smarter, faster. Why are you doing what you're doing? Why are you here? Why do you want to practice medicine? For me, my personal why is my faith. I've been a Christian since college, and I feel like The Bible calls me to love my neighbor as myself. It's difficult in the ER. Often I'm cussed out, I'm spit on, I've been hit by a patient. I've had things thrown at me. A thing of antiseptic wipes was thrown at me by a patient because I didn't give him the medicine he was begging for, that would have harmed him. It's easy to become jaded. It's easy to become angry and view patients as less than human. But returning to my personal why, I know these patients are made in God's image, and so I treat them with the empathy and respect that they all deserve. So here's a challenge. I'm winding up. What will you bring to the PA profession? What will you do to bridge the gap of trust between us and our patients? Will you be a humble PA, eager to serve your patients and learn from them? Will you wear this white coat not as a status symbol or barrier to care, but wear it as a reminder of your commitment to bridging the gap between PA and patient and restoring the integrity of our profession? I would like to leave you with some words from the famous physician, Sir William Osler, that I hope you will apply to your PA training and practice going forward. So let me read this quote to y'all. Throw away all ambition beyond that of doing the day's work well. The travelers on the road to success live in the present, heedless of taking thought for the morrow. Live neither in the past nor in the future, but let each day's work absorb your entire energies and satisfy your wildest ambition. Thank you all so much for your time and attention.
Thank you for sharing those thoughtful words with us. Now, we will help each of you into your white coats. Please line up one row at a time and come forward as your name is called. As a courtesy, please hold your applause until all names have been called and students have received their coats. Will the first row of the class of 2025 please rise and approach the front of the stage? As your name is called, please rock across the stage and stand in front of the coding faculty.
Serena Hope Abuzaidan. Jinju Bang. Amaya Beckham. Macy Benvenisti. Taishiana Antia Brandon. Turner Miles Britton. Lauren Captain. Leighton Faxon Corsi. True Mi Ti Dao. Alicia Dennis. Shifa Gandhi. Taylor Grimmett. Eileen Hahn. Sarah Hamus. Brandon Lonius. Ashley Elizabeth Leek Levine. Tiffany Martin. Grace Elizabeth McLaughlin.
Besanat Mingusha.
Rimaz Moyheldin. Carly L. Moore. V. Kim Nguyen. Olivia Lisette Pratt. Kaylin Rosina. Juliette Adele Russo. Alex Seymour. Blake Sidlick. Madeline Siglinger.
Anna Sisson.
Lashaya Smith. Brianna Janae Stiff. Cameron Devon Noel Taylor.
I would like you to consider the significance of receiving your white coat and the oath that you are about to pledge in the next few minutes. You are being entrusted with a tremendous privilege and responsibility. In some instances, you will work with patients and families during their most vulnerable times. You will deliver news that will alter their normal indefinitely. While you may become accustomed to the disappointment and tragedy and joy and relief, it will be deeply personal to the patients and families that you serve. I caution you to not become desensitized by all the extraneous aspects of the job. Do not replace the practice of medicine with the business of medicine. Rather, be cognizant of the impact of your actions as you progress through your schooling and throughout your career. Your actions are far-reaching, extending beyond the patient to family and friends. Now, I would like you to stand, and I'd like to invite Professor Carrie Nold to lead you in the Pledge of Professionalism.
All right, students, we will now recite together the Pledge of Professionalism. Remember, this is printed on your brochure. If you can raise your right hand, and you'll just say it along with me. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patients' autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my medical knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor.
Please be seated. Physician Assistant, Class of 2025. I have a question for you. It is not anything that you would expect me to ask you today. Do you want to be a ship, or do you want to be a submarine? Ships sit on the water, and as long as the waters are calm, the ship is calm. but ships are influenced by the environment around them. When the winds come and the waters get rough, the ship will get tossed around and become unsteady. The calmness of the ship is dependent on surrounding factors and is only surface deep. In contrast, a submarine is not influenced by the surrounding environment. Weather conditions can only affect water depths of about 25 feet. A submarine is carefully constructed, equipping it to be submerged as much as 500 feet. The design of the submarine and integral elements in the construction of the submarine enable it to go deeper, to make consistent advancement towards accomplishing the mission, and to be calm regardless of the surrounding environment. You all are bright. I think you know the right answer. You want to be a submarine. There are 3 integral elements that I believe are essential in you becoming a submarine. These elements or character qualities will enable you to traverse tumultuous times while remaining calm, establish patient-provider relationships that lead to enhanced quality care, and exemplify the traits that the white coat symbolizes. The first is integrity. People of integrity possess strong moral principles. They are honest, dependable, and exercise good judgment. The second is humility. Acting with humility is demonstrating respect for others and the value that their insight and experience can add to a situation. It is placing others above oneself. The third is courage. Courage requires the mental and moral strength to try, persevere, and endure times of uncertainty and difficulty. It is action in the face of fear. I would like to remind you that with great challenge comes great opportunity. You will undoubtedly be faced with multiple challenges over the next 2-year period. Recognize, however, that the opportunities which exist as a result of your dedication and attitude will be abundant. So I challenge you to consider the character qualities that have been discussed today and commit to continually grow and strive to be that individual. Finally, family and friends. There are no free passes being handed out today or over the next 2-year period. You have your work cut out for you as well. Your job will require grace, keen insight, perspective, and unconditional support. Your services will be in greatest need when your PA student is succumbing to fatigue, stress, and self-doubt. Just as they expect themselves to be on for every exam day, you too will be expected to be on for each and every mini meltdown. Be gracious in your dealings with them, as you will be the likely recipient of their fatigue and stress. Recognize that your keen insight will be needed to become an expert at reading the situation and responding accordingly. Knowing when to be silent, when to speak, and what to say will become your new art form. Offering perspective is hugely important. You will witness a substantial growth in their knowledge and maturity over the next 2 years. Their transformation will be astounding and evoke immense pride within you. The challenge is that they are so immersed in this process that it is incredibly difficult for them to recognize their own progress. In their minds, there is so much more to learn, something else that still needs to be done, and everyone else around them knows more. You need to offer them encouragement and help them to see their accomplishments along the way. Lastly, support comes in many forms. Sending a Dunkin' Donuts gift card during exams or a care package of snacks can make their world go round and never disappoints. This is an exciting time for them and for you. Never underestimate the vital role that you will play in their success. Thank you all for joining us to celebrate this momentous occasion, and I would like to offer a very special thanks to our Office of Student Affairs for putting on this ceremony today.
At this time, we ask that you remain seated until the faculty and students have completed the recessional. At that time, we will have the students gather outside for a group picture. We ask that the families remain in the room for a few minutes and allow the photographer to take the class photo without disruption. Thank you so much.